We get the question all the time, when am I ever going to use this? How is this relevant to what I'm going to do? So the college wanted to make sure that these healthcare students have seen how the math is used within their careers. I teach a Math 80 computer modularized course but many of the topics and examples is not contextualized towards the healthcare careers. So what we try to do is develop a contextualized part.
I think emphasizing the importance of math in the prerequisite phase is helping to give students advance notice, if you will, and in a way give them a leg up, because they won't be so surprised when they get to nursing school. And they'll have a little bit extra time to prepare and understand that they really do need to understand the mathematical processes, and they need to understand how to apply it to nursing and to the relevant areas of healthcare.
So many of the students in this class are incumbent healthcare workers, so they're already working in the healthcare field. And so when they see the contextualized math questions, there's an aha moment that happens, because they're like, oh, yeah, I can see where I'd use this in work.
I work as a nurse, and so the thought was, my experience in, the clinical experience as a nurse would be helpful to bring in to help contextualize and make those prerequisite courses more relevant, and bringing in clinical examples, for example.
And a lot of it has to do with dosaging. So that's kind of what we try to focus on in the contextualized math.
I would look at the content and come up with areas where that subject was applicable to what I do as a nurse in a clinical setting. For example, in math, we do a lot of medication calculations, dosage calculations, that type of thing. And so it was fairly direct to link the clinical necessity of that topic. Just come up with case studies, and it was pretty straightforward to link those two.
And within the nursing program at North, they have to take 3 different math-based assessments, which they have to score 100% on to remain in the program. And so we were finding that it helped to review with the students before taking those assessments, to reduce the anxiety for one, but also to give them practice, because there's a lot at stake with needing to get 100% in order to continue to move on.
Right.
So, if somebody's having trouble in math, being able to help them set up the problems in a way that makes sense, and being able to use those clinical examples to help them see exactly why they're doing what they're doing, and going through the stepwise process of getting there, and helping them to see the checks and balances along the way. It definitely helped.
Yeah, so it's not just calculating a certain number, having to relate that number to what they're doing. I think that's kind of surprising and a challenge for most people.
The interesting thing is too, many of them can do it on the job, no problem. But when it comes to actually doing it on paper, then it becomes difficult.
Yeah.
If they can just imagine, what would you do at work in this scenario? They can do it. It's just putting the paper.
Yeah, just reading it on paper and having to calculate it out is just something that it traps them.
Yeah.
So being able to teach students that it's not just one way, it's more than one way to be able to convert to a certain, like maybe converting between the US system and the metric system.
Keeping track of units too is, if the answer needs to be in tablets versus milligrams, just so that they're keeping track of what is the question really asking.
Right.
And what would I be giving my patient?
I know I was guilty of this as a student, and I'm pretty sure most students are guilty of this when they're in a class and they especially are struggling with a difficult concept, and they say, when am I ever going to need this? Well, this is how, contextualization brings this is how you're going to use this in the future to the table.
I mean, being able to make that connection with the math that you're learning to what you will do later on, it really does click with the students. And I think it's worth the time and the effort to do that for our students.
Especially if you have a cohort of students that are all kind of going down one path.
There were instructors that were just really, really excited about the idea and just really excited to see how their topic directly related to to healthcare and to the clinical setting of healthcare.
It gives a purpose to what they're doing.
Exactly.
And that can be very beneficial for keeping students in school and moving forward.